Hi, my name is Quinton and I'm from Pain-Free Physiotherapy and Allied Health. I'm here to talk to you about low back pain. About 80% of people will experience low back pain sometime in their lives. It is one of the most common causes of job-related disability and one of the leading contributors to taking days off work. In some cases, low back pain may resolve without seeing a health professional, but for about 80% of low back pain cases, it isn't possible to determine the exact cause of the symptoms and are often diagnosed as non-specific low back pain. So what will most doctors say to you? Your doctor may refer you to get some sort of imaging, so it could be X-ray, CT scan or MRI scan, and in most cases the imaging will show some sort of degeneration or disc bulge. And then that way the doctors can make an easy association with the symptoms with those found on the findings and just be given as a convenient diagnosis. But that's not necessarily the case. It's like saying that when we grow older, our hair will go grey, as it's just a part of our normal aging process. Likewise, it's the same with our spine. As we grow older, our spine will start to show some degeneration and disc bulges. So this is not always the cause despite the findings from the scan. Now, further advice for acute low back pain from sprains and strains is to rest at home initially, use ice packs, and maybe over-the-counter anti-inflammatory medications or pain medication. And it is quite important to be as active as possible and gradually return to those activities you normally do. So what do we do differently at Pain-Free Physiotherapy? At Pain-Free, we are experienced at using a holistic approach to assess the whole body to look for all the contributing factors that led to your symptoms and prevent them in the future. So we'll be performing a head-to-toe examination to find those key points. Most of the time, we will find that the cause is actually not in the lower back, so it could be in the calves or in the shoulder. So if we use the human body as an example and we split it up into 3 zones, we have the upper body, the trunk, and the lower body. The trunk is built to be nice and strong, like this tight spring, and then our upper body and lower body are quite loose for us to move around. But if we flip it around and we find that the upper body and lower body is quite tight and that the middle zone, our trunk, is quite loose, when we move around there'll be excessive movement in this area and that causes the low back pain. So treatment-wise, we can identify those tight structures in the upper and lower body and try and loosen them, or we could provide extra stability in that middle area. So, at the end of the initial assessment, we'll be outlining 3 main things. 1, what is the cause? Now, as I mentioned before, it could be anywhere in the body, and it doesn't have to necessarily be in your lower back. 2, what treatment do you need? You may be surprised that we don't have to even touch the low back. And 3, how many sessions or how long will it take for you to achieve your goals? And most of the time, we will see significant improvement within 3 to 6 sessions. We'll give you a home exercise program based on where the cause is. If we find that the cause is the calves, then we will teach you exercises for your calves even if the symptoms are coming from your lower back. Let me show you how. So this exercise is a calf self-release, and what you'll need is a foam roller. Okay, so now you're going to go down onto your knees and put the foam roller about 1/3 of the way up from the ankle, just like this. And then you're going to lean back and put pressure onto your calves. And just to make sure that you're on the spot, you can lean side to side and you'll feel quite sore where the pressure is. So, if you are following the mainstream ways from your doctor or other physios and you're still quite frustrated about your low back pain, or you just want to learn more, feel free to come and talk to us and we'd be happy to answer all your questions and tell you what we do differently for low back pain.